everyone. We have a few folks rolling in, but I'm going to go ahead and get started in the interest of time. Thank you for joining us this afternoon. Welcome to Navigating Medicare. My name is Ashlyn Levitt, and I'm the Assistant Director of Events and Volunteer Management for Grand Valley's Alumni Relations Office. As Grand Valley alumni, our commitment to you is as a Laker for a lifetime. We will always be alongside you and all of our alumni, ready to help you reach your next goals. No matter what stage of your life or career, you can turn to us for a lifetime of support. With this idea in mind, last January, we hosted the Retire Well series. This series was created with our Bedrock alumni in mind. We wanted to bring you applicable and accessible programming where you could learn the information you need to know both before and during retirement. Past virtual programs focused on estate planning for retirement, maximizing Social Security, investing and income in retirement, and the hidden costs of aging. These programs are still accessible on the Grand Valley Retire Well website and through using the QR code now on your computer screens. If you're not familiar, you just hold your phone camera up and you can scan the code on your screen to access this programming. Fall brings Medicare open enrollment from October 15th through December 7th. So we thought it would be beneficial to provide an updated Medicare presentation to assist those who may need it. I have the pleasure of introducing Melissa Stewart, who was instrumental in the creation of the Retire Well series this past winter, as well as Kelly Seren, who will be facilitating our programming this afternoon. With that, I'm going to hand it over to Melissa. Melissa, would you like to share a bit about your own background?
Yes, that would be great. And if you're okay with it, I'll go ahead and share my screen as well too for just a moment here. Hopefully, if I get this right here. Good old technology. Screen 2, there we go. All right, so hopefully that presentation is up there. Can you see that okay? Great. Well, thank you so much for letting me be a part of this. The Retire Well series is something that I've been putting together now and hosting for over 10 years. And just recently, I was on the alumni board at GVSU for 5 years, and just recently I rolled off of that board. But I spoke to the alumni area and association and said, hey, I have this great content, and I'm just wondering if this would be of use to GVSU alumni. So this series, I've had time to curate some amazing speakers to talk at it. And usually we give it on an annual or semi-annual basis. And that's how the Retire Well series came about. And actually, part of my job as a financial advisor is I work with individuals, helping them prepare for retirement through financial planning and investment management. But I also work with larger institutions, helping them manage their 401ks and 403bs. And this came about when an HR director said, hey, I have all these employees that are getting ready for retirement. Can you please put together a series of the information that they're going to need to know as they're entering into retirement? And Medicare is a huge piece of it, right? One of the most important pieces of it, along with Social Security and how do I take my retirement savings and change them into a way to replace my paycheck. So that's really where this series came from. So when we talk about Medicare today, I really think of Medicare falling in this risk management space, right? Choosing the right healthcare plan for you is really, really important, because if you choose the right one, it can cost you less money in the long run. And if you choose the wrong one, it can cost you more money in the long run. So just like we have homeowners insurance or car insurance, healthcare insurance is just there to help us mitigate some of those risks when it comes to the costs that are involved in taking care of yourself and your health. And when we do financial planning, we actually include that right in your financial plan. So at Clear Vista Advisors, I'm a certified financial planner and an accredited investment producer. I graduated from GVSU in 2009 with my bachelor's focused on business administration and finance. And then I was at other financial institutions for 15 years before I opened up Clear Vista Advisors 2 years ago. And now at Clear Vista Advisors, we are very, very financial planning focused. And as part of a client's financial plan, we actually budget for these healthcare costs that Kelly is going to talk about here in a moment, right inside your financial plan. So with that, after today's meeting, you will receive information on how to contact Clear Vista Advisors, how to contact Kelly and her team. So please know that you don't have to write all this information on right now, because there will be follow-up emails that GVSU is going to send you with our contact information. And lastly, we want to keep today's conversation as active as possible. And in today's digital virtual world, sometimes that can be hard. So there is that chat box, and we really encourage you to ask questions along the way. Ashlyn and I will be moderating those and letting Kelly know when there is a question that's being asked. So go ahead and type your question in there. And then when it's appropriate, we'll interject and we'll ask Kelly these questions along the way so that we can keep today as active as possible. So Kelly is with her own company, Voyage Benefits. Kelly became licensed as a health and life producer back in 2006. So she's very experienced in this area and has had a passion for providing health insurance and Medicare guidance for clients ever since. Prior to forming Voyage Benefits, Kelly worked extensively in the employee benefits and financial services industry with an emphasis on health and life insurance products and retirement plan administration. With more than 17 years of professional experience, she is an excellent resource for individuals and families who may be facing a transition in their health coverage, or who just simply would like to review their current health care or Medicare benefits. So I won't go through it all, but Kelly, I've had a chance to work with Kelly here now for a little bit of time, and she's done an amazing job helping those who I've referred over to her way. Her and her team do a great job, and I'm just so thankful to have her here today to share her expertise. So with that, I'll go ahead and pass the baton over to you, Kelly. Thank you for joining us today.
Well, thank you for having me, and welcome everyone. I'm going to go ahead and get my screen up on here for us to run through. And hopefully you can see the title slide here, Navigating Medicare. Again, as Melissa kindly introduced me, my name is Kelly Seren. I am the owner of Voyage Benefits. We are local right here in Grand Rapids, and our primary focus is to really put out this education for anyone who may be interested or has questions about Medicare or health insurance in general. This is kind of a little overview on who we are. Again, we kind of see ourselves as a concierge. We really want to take a whole hand-holding approach with anyone that comes through with questions. Our goal is to really make sure that you understand the ins and outs of Medicare, when to sign up, what these different plans out in the market are, and just to help you understand your coverage. So really all of these different points of our goal are really centered around you as an individual. Everyone has different and unique needs. And so we do really try to take an individualized approach with every client or prospective client that may want to reach out to us for help. So first bullet point is we do like to provide all of this education, and therefore the reason for this webinar today. We do provide enrollment support, not necessarily with strictly Medicare plans, but we do also take a hand-holding approach to applying for Medicare if you're newly eligible. So those folks who are approaching age 65 or who are thinking about retiring and maybe losing coverage from their employer, feel free to reach out to us. We do the Medicare applications online with you. I know that sometimes working through the website can be challenging for some, and so we really just want to make sure that you have somebody to kind of take a second look as you're going through that application to make sure that everything is completed the way that it's supposed to be, so that we can avoid any kind of delays or hiccups down the road. Again, we take that personalized approach. We do ask questions pertaining to what doctors you may see, what prescriptions you may take, what your plans for travel across the United States may look like post-retirement, just so that we can kind of narrow down the playing field when it comes to some of these supplemental coverage or policies that are out there. It's mind-boggling, and I'm sure as some of you are 65 or are approaching age 65, you know that it's quite a crazy time of year right now, especially with being inundated with phone calls and mailers and lots of information being thrown at you from all different insurance companies. And so really by taking that personalized approach, we're able to narrow down the playing field and maybe just present some things, some options that may be pertinent to your situation. We have a team here that will provide on-call service. So once you are enrolled in a Medicare plan, we don't let you question on your own. We have 3 people now in the office here that will field those questions as it relates to billing or claims or prescription coverage, things like that. And then once a year, we do go through and perform annual coverage reviews with all of our clients. So we've been extremely busy here the last few weeks during the open enrollment period, just kind of making sure that everybody is in the plan that suits them best for the upcoming year. So even if you are already enrolled in a Medicare plan, it doesn't hurt to have a licensed broker take a look at that coverage and maybe do an analysis for you to make sure that either remaining on that current plan is wise, or perhaps making a change might be in your future, or maybe we find a plan that better suits you for the upcoming year. Okay, there's never any fee to work with our agency here. We do all of this consulting with clients at no cost, and we're right here in Grand Rapids. We love to have clients come into the office and meet with us. The way that we are compensated specifically is if you do end up enrolling in a supplemental plan or a Medicare Advantage plan. We're independent. We offer a variety of different insurance carriers. And so if you do in fact enroll, we earn compensation directly from the insurance company. And that compensation allows us to service you throughout the whole calendar year. Okay. So again, this is my team. This is myself, Kelly. I'm the owner and the principal of Voyage Benefits. And then I've got 2 lovely ladies here. We've just added a third, hasn't been added to our slideshow here yet, but they do their best to joyfully engage with clients, answer questions as they come in. So today, what we're going to be going through are just the basics of Medicare, Part A and Part B. What it is not, what it may cover, how much Medicare costs on a monthly basis. Do I need it? Some folks who are still actively working, that is kind of the $1 million question as they approach age 65 is, do I need to sign up for it if I'm still going to be working past 65? How Medicare may interact with a health savings account. Some of the pitfalls that maybe you might want to be aware of so that they can be avoided. When and how to sign up for Medicare if you are going to be newly eligible for Medicare. Prescription drug coverage. This is a big one that we talk about quite frequently, especially for folks who may take a variety of prescription drugs, those that may have prescription drugs that are in a brand name category, and dealing with some of the feelings of being on a roller coaster rides, sometimes with the costs involved in filling those prescriptions. We're going to talk a little bit about these private plans that are out there and being very heavily advertised right now. There are primarily 2 different kinds of extra coverage that people may entertain to kind of supplement Medicare. Medicare Advantage plans and then traditional Medicare supplement plans. And then lastly, we'll just briefly touch on individual coverage. So every once in a while, we do meet with clients that may have a spouse or dependents that they're covering, that when they actually go into the Medicare program, what do we do with those dependents that may not yet be 65? Okay. So we'll just dig right in. What is Medicare? Medicare is, in a nutshell, it's just health insurance that you have paid into all of these years and are able to partake in at the age of 65. Another eligibility window is if you have not attained age 65, but perhaps you've been awarded disability benefits. Typically, after about 2 years of collecting Social Security disability benefits, you'll be able to enroll in Medicare. Other individuals who have been diagnosed with certain chronic illnesses, such as end-stage renal disease or Lou Gehrig's disease, do also become eligible for Medicare. And really what it consists of is 2 different parts. I call them buckets. There's part A and part B. Okay. Sometimes people are able to enroll in just part A, or you may enroll in both part A and B. Okay. Part A, we're going to get into in a moment, as well as part B. But what I also like to touch on is what Medicare is not. Sometimes these terms sometimes get confused or used in lieu of one another. So one thing Medicare is not is it's not free. So we're going to get into some of the costs, the monthly premiums that are associated with Medicare. And I'll preface that by saying that what I'm about to present here today is reflective of the upcoming year. So we do have updated premiums shown for 2024. Medicare is not a family plan. So again, for folks who have been working and all of those years they've been insured as a family unit. When you're eligible for Medicare, it is every man for themselves. So every person is treated as an individual. Medicare is not Social Security. Of course, they sometimes will intermingle with each other, but these 2 different government programs may be elected at different times. That being, you may go ahead and enroll in Medicare, but perhaps wait on your Social Security. Social Security being the monetary benefit that you are eligible for, and Medicare, of course, being the insurance benefit that you may be eligible for. Medicare and Medicaid. Again, these 2 terms sometimes get mixed up. Medicaid is actually a state based program for people who may qualify due to income. Okay. So again, it is health insurance, but it's more so based on a person's income rather than age. So Medicare is usually for people who are over 65. That being age-based. Medicaid is usually available to people who qualify based on income, so financial-based, okay? So we're going to dig a little bit more into Medicare Part A. This is just one of the 2 buckets of Medicare that's available to people. One of the requirements is that you have had to have worked at least 10 years in the United States and have paid in through means of those Social Security taxes, okay? If you have fulfilled that requirement, then you are able to partake in Medicare Part A, typically at no cost. So what Medicare Part A entails is it's specifically hospital benefits. That being that you have been formally admitted into the hospital. And that takes a lot to happen these days for a person to be formally admitted. And when you're formally admitted, it doesn't mean that Medicare Part A is going to cover every penny of the expenses that may accumulate. There are deductibles that apply and daily copays that apply. Now, typically, a person will go out and maybe purchase or enroll in some kind of additional coverage to pay these particular deductibles and copays. So for example, if you didn't have anything else, if you didn't have any kind of Medicare Advantage plan or supplement plan, and you were just simply relying on Medicare Part A benefits, these are kind of the figures that have been announced here for next year in terms of a deductible. When you're admitted into the hospital, there's a deductible now that applies of $1,632. And when you've paid that deductible, that essentially buys you about 60 days in the hospital. Okay, whatever goes on in those 60 days is typically covered when you've paid that deductible. But perhaps you're in the hospital longer than 60 days. At that 61st day, Medicare kind of steps back and says, remember the deductible you paid when you were first admitted? Well, it's been 60 days. You're still here in the hospital. And so now we're going to charge you a daily copay of a little over $400 per day, $408 per day for the next 30 days. Okay, so now we're into the third month of being in the hospital. After that third month, Medicare is pretty much all done. It's a 90-day benefit period. Now, as a backup, individuals do have what I call a little bucket of extra days. If you need days beyond 3 months, you can dip into this little bucket of extra days. And there are 60 days in there to use over the span of your whole lifetime. And they're not free. Okay. They're actually $816 for each additional day you pull out of your bucket beyond your 3 months in the hospital. Once those 60 days are up, you're on your own. Okay. Another type of hospital facility could be what's called a skilled nursing facility. And this may be a place for short-term rehabilitation. You may go from the general hospital to another type of facility like this for rehabilitation. And Medicare will essentially cover about 100 days, with the first 20 days in that facility being covered in full. But under the requirement that you have just come from the general hospital and have spent 3 full nights in the hospital. Okay. After that 20th day in that skilled nursing facility, there is a daily copay of $204. And after the 100th day, you're on your own. Okay. Other things such as home health care, hospice care for those patients that have been diagnosed with terminal illness, that is typically covered under Medicare Part A, also at no cost. Okay. I don't see, I actually do see a few comments here in the chat box, but no questions as of this point. So I'm going to keep going and talk a little bit more about Medicare Part B, the other part of Medicare. Okay, this is typically for things that happen on an outpatient basis, such as a doctor's appointment, a trip to the emergency room. Although that may occur in a hospital setting, you're not formally admitted. And that's kind of the fine line, okay, between Medicare Part A, where you are admitted, and Medicare Part B, where you're outpatient. Ambulance ride, testing, different types of equipment that you may order for a CPAP machine or oxygen, okay, different outpatient procedures. And in a nutshell, when people are using this Medicare Part B, there is a deductible for these types of services. And next year in 2024, they've announced that the new deductible for a person is about $240, which isn't significant, but just want you to know that that's out there, where Medicare Part B is not going to cover any of these things until after you have fulfilled that first $240. Now, again, when people go out to enroll in extra coverage, a lot of times this deductible may be waived, okay? And then after that deductible is met, Medicare will cover at about an 80% share. The concern that I have is that if you experience a big diagnosis, let's just say that you are diagnosed with cancer and have to start undergoing chemotherapy, Medicare will cover about 80% of the chemotherapy, but that leaves you holding a bill for about 20%. And if we're looking at $100,000, your responsibility then, of course, would be $20,000. And there's no cap on when Medicare will actually come to the rescue. You're kind of on your own at that 20% for an unlimited amount of expenses. So again, that's kind of why people will go out and research these different types of insurance policies to at least give you some kind of cap or maximum for the year.
Kelly, we
Okay.
did have a question come in, and the question was, which I think might be part of this next part, but the question was, does the deductible for Part B change each year?
It does. So this year in 2023, the deductible was $226. So every year, the government will usually announce what the upcoming year is. They just announced it here in October. What due to inflation and rising costs, they adjust that annually. So next year it will go from 226 to 240. Okay. Now, this particular portion of Medicare is not free. It does have a monthly premium associated to it. And what I'm showing here is per person, per month, the rates that have been announced for 2024. So again, just to kind of outline the change, these do also update on an annual basis. This year, what most people are having assessed for a monthly premium for Part B is $164.90. Next year, it is going up by about $10. So usually about the end of the year, it will be announced if we are going to have any kind of cost of living increase, that meaning you might be getting a little raise in your Social Security if you're collecting. But on the back end of it, they also raise the Medicare premium. So it's, kind of neck and neck there. Now, these different premiums, you see 6 different premiums here. What Medicare does is when you're going to be applying for Medicare or are on this Medicare Part B, they're actually going to be referencing your tax return from about 2 years ago. Okay. So this year in 2023, they're looking at your 2021 tax return. Next year in 2024, they'll be looking at your 2022 return that you filed. And basically what they're looking for is what income bracket do you fall into? Okay. If you are a single person and as your modified adjusted gross income shown on your 2022 tax return, if you are below 103,000, then you will be assessed what every other American on Medicare Part B is assessed, $174.70. If you're married and filing a joint tax return, that threshold is about $206,000 or less. But perhaps you may fall into one of these higher income brackets. Okay. The more money that is shown as reported on your tax return, the more you may have to pay in terms of a monthly premium for this Medicare Part B. So these surcharges based on a person's income, it's what's called IRMAA. IRMAA, and that stands for Income Related Monthly Adjusted Amount. Okay, we're going to talk a little bit about what happens when a person who may fall into one of these higher income brackets from their tax return from 2 years ago, what happens when they retire and now their income is significantly going to change or be reduced. There is a way for us to file what we call a redetermination or an appeal, citing that you have experienced what we call a life-changing event. That meaning that when you enroll in Medicare, they're going to be referencing your income from 2 years ago when you were actively working full-time. And maybe you happen to have fallen into a higher income bracket during that year. But now you're going to be experiencing this life-changing event, and as a result, your income is going to change. So this is a example of the form that we use to kind of reach out to Medicare to say, hey, I retired. We check the box that says work stoppage, and this is the date I retired. And going forward this upcoming year, post-retirement, this is what we believe our new income bracket is going to look like. And so if we do that soon enough, we can kind of nip things in the bud where you don't have to go the full year paying a higher premium when you are experiencing a life-changing event and you've got a new reality post-retirement that brings you down below 206,000.
Mhm.
Okay. So we're
Kelly, can
proactive.
I add to that too? So
Yeah.
I think it's so important to keep this previous chart in mind when you're working with your personal financial advisor. Because if your advisor does like a large investment portfolio change, that can trigger capital gains for you, right? Which is going to increase your income. Maybe they could do that change over 2 years or 3 years versus 1 year and get you above this amount where now you owe, $150 more each month for your Medicare Part B. Or another situation would be a client who is looking to buy maybe a condo down in Florida. They're lucky enough to do that, and they want to withdraw that money out of their retirement savings. Well, if we do that all in 1 year, they're going to pay higher taxes and higher Medicare premiums. What if we can take that distribution out over several years and not increase their income, have them pay higher taxes and higher Medicare Part B premiums? So I know today we're just talking about Medicare, but this particular part actually really does relate to your kind of like your financial plan, your financial strategy, and trying to keep this in mind so that you don't have to pay extra money when it's unnecessary.
Excellent. Now, most of the time, for folks who are actively collecting their Social Security benefits, these monthly premiums are withheld. They are deducted right off the top before you even see it. Okay, but some folks actually will hold off on collecting their Social Security benefits. And for those particular people, Medicare will send a bill. It's usually on a quarterly basis. Or we can work with you to set up what is called Easy Pay, where if you'd rather have it deducted from your checking or savings or even your HSA on a monthly basis, we can get that set up. Okay. So again, this is the form that we will work with people if we do see that, in the past few years, you had fallen into one of those higher income brackets, but now post-retirement, you're going to fall below. We can kind of nip things in the bud and create some relief for you sooner than later. Okay. Some things that Medicare Part A or B do not cover. Absolutely nothing for dental coverage, nothing for vision or hearing or prescription, believe it or not. Medicare does have very limited coverage outside of the US. So for people who are maybe planning a trip overseas, we do quote different international coverage to provide a little bit more comprehensive benefits for people when they travel abroad. Long-term care is another area that Medicare does not cover. Again, if you are admitted into a hospital or even a rehabilitation center, there are limits on how long Medicare will actually pay. It is not meant to be a vehicle for you to use to cover you to reside in a nursing home. Okay. Some of these benefits are able to be purchased through means of this extra coverage, that being supplemental coverage. Now, here's one question that we do get asked quite frequently, just because we do work with quite a few people who are still actively working when they turn 65. And it does kind of create a lot of anxiety for a person around that time when they're turning 65 because they hear, you need to sign up for Medicare. If you don't, if you miss your opportunity, you may be in trouble for the rest of your life in terms of having these penalties apply. Well, I kind of want to nip that rumor in the bud because for some people, they do have a choice as far as whether they enroll in Medicare or not at 65. So one of the things that we just want to make clear is that you may choose to not enroll or delay enrollment in Medicare without having any kind of consequences under the following conditions. If you are working or your spouse is working and you have access to employer benefits, and that employer has more than 20 people that work there, you may decide that it's more either economical for you to stay under your work plan or go on Medicare. Okay, so this is kind of where we do an analysis to look at what are your benefits that are offered by your employer versus what if you did go on Medicare. Okay, we kind of compare apples to apples. You or your spouse are disabled and you're covered by employer benefits that are through an employer that has more than 100 employees. Okay. You may choose to enroll in Medicare Part A at age 65 if you want to. It doesn't hurt you in most cases because Medicare Part A does not have a monthly premium. Okay. But if you are a person who is actively contributing to a health savings account, an HSA, sometimes we do discourage or, dissuade you from signing up for Medicare Part A. And I'm going to talk a little bit more about that in the next slide, as far as what enrolling in Medicare Part A does to your eligibility to be able to put money into an HSA. Okay. You may enroll in Medicare Part A or B or both later on, maybe upon retirement. When you lose that employer coverage, let's say you are 68 years old and you decided when you turned 65, it did not suit you well to go ahead and sign up for Medicare. So you didn't. You stayed covered under your employer plan. And now you're getting close to retiring, and you know that upon retirement, you're going to lose those benefits through your employer. Okay. We can go and get signed up at that point in time, and you will not be penalized. And I'm going to go into the specifics in a few slides as far as what needs to be done to avoid penalties for enrolling in Medicare beyond the age of 65. Okay. On the other side of the coin, some people are strongly encouraged to enroll in Medicare upon turning 65 if they work for a small company. That means they get their benefits through an employer that has less than 20. Really, what it boils down to is if you're working and you have access to employer-sponsored benefits. If you work for a large organization, those employer benefits are always going to kind of serve as what we call primary. Okay. You don't have to go and sign up for Medicare if it doesn't make sense. But for people who are employed by small entities, small employers, when a person or an employee turns 65, that small employer is going to kind of revert back and say, if you've got access to other coverage, that being Medicare, we'd really like you to enroll in Medicare. Okay. We're going to kind of revert to a secondary status, meaning that if you don't have Medicare set up as your primary source of insurance, there may be some hiccups with how your medical bills are paid. Okay. If you are covered under COBRA, that means if you elected COBRA when you left employment, when you turn 65 and you're on COBRA, it is very strongly encouraged that you go ahead and enroll in Medicare because, again, COBRA is going to act as a secondary form of insurance. And if you don't have Medicare set up as primary, again, there could be some problems. If you buy your health insurance through the marketplace, through healthcare.gov, or if you have Medicaid or you're participating in one of these Christian health sharing ministry plans, most of the time it is very strongly encouraged that you sign up for Medicare when you turn 65. Some of these other people who may have access to different retiree coverage plans, that being maybe through the state of Michigan or the Michigan public school system. Normally, for you to be able to partake in those retiree benefits, you do need to show proof that you have enrolled in Medicare Parts A and B. Okay.
Hey Kelly, we did have a question pop up in the chat here. I'm
Mhm.
wondering if Medicare premium cost is taken from Social Security, is that pre-tax or after tax?
I do not know the answer to that. That would be,
Yep, I was typing that in there. So it's gonna be an after-tax amount that is taken out. So let's say your social security payment is like $2,000 a month. They're gonna look at that $2,000 as income when it comes to taxes, and then your Medicare payment comes out of that. Let's say it's $170, but you're still gonna be taxed on that whole $2,000, but only part of your social security benefit is taxable. And when you look at that Retire Well series, we have a whole presentation on social security, and it goes into the taxation of social security. So I'm happy to, if you email me, I'm happy, or call me, I'm happy to go through that more.
perfect. Thanks, Melissa.
Yep.
So one of the things that I had talked about before a little bit was whether or not enrolling in Medicare Part A is a good idea when you turn 65. If you are still actively working and perhaps contribute to what we call a health savings account, an HSA, when you go to sign up for Medicare Part A, one of the requirements, I'll back up a little bit. One of the requirements to be able to compliantly contribute money into this HSA is that you are solely insured under a high deductible health plan. Okay, HDHP. And when you go to sign up for Medicare Part A is not a high deductible health plan. So you are no longer solely insured by a high deductible health plan, and therefore you've just forfeited your right to be able to contribute into your HSA. Okay. Now, one question that comes up occasionally is if you are the employee and you are the one having those payroll deductions taken out and put into the HSA, what about your spouse? Maybe your spouse has Medicare Part A. That's okay. It's really defined on whose name is that HSA in? Who's putting the money in it? If you are the person who is the HSA account holder, and if you are the person that has Medicare Part A, then there could be some issues with that. But if it's your spouse who has Medicare Part A and you're covering your spouse, you may still go ahead and put that money into your health savings account on behalf of both of you. Okay? Because your spouse is not the one who is the HSA account holder. Your spouse is not the one putting money in it. You are. And as long as you don't have Medicare Part A, then you may continue to do that. Okay, so again, can I keep funding my HSA? Yes, if you are actively employed by a big employer over 20, you're on their high deductible health plan, and you don't sign up for any part of Medicare.
But
Okay.
they would, Kelly, correct me if I'm wrong, but they would be limited to like the individual contribution maximum limit. They couldn't do like a family contribution maximum
From
limit.
what I
Correct?
understand, they can do the family if they are covering a family on that high deductible health plan.
Okay, that makes sense.
Even if the spouse has Medicare Part A, they may still make that family
Contribution.
contribution. Yep. But no, you may need to stop funding your HSA if you go ahead and sign up for Medicare. Those two just do not play well with each other. Okay. Now, one question that we occasionally get too is people hear about this 6-month rule when it applies to an HSA. Really, this little snippet here really applies to people who at the age of 65, maybe they still were working, maybe they still enjoyed being able to make those tax-free contributions into their HSA, and therefore they did not enroll in Medicare. Okay. Let's say that now that person is 68 years old and is deciding to retire. and that means they're going to be applying for Medicare. What is going to happen is down the road, okay, this is not for people who are going to be enrolling in Medicare right at 65. This is specifically for people who delayed signing up for Medicare at 65 and are now going to sign up for it later at a later age. When you go to sign up for Medicare at a later age, what's going to happen is they're going to actually make this Medicare Part A go retroactive in time as far as its effective date back about 6 months. So technically, that means that about 6 months in advance of you going and applying for Medicare, you need to stop your HSA contributions. Okay, again, I want to emphasize this is not for people who are going to be electing Medicare right at 65. You do not need to stop 6 months in advance. This is for people who are delaying Medicare at 65 and applying for it later on. Okay, so just keep that in mind. If you decide not to enroll in Medicare at 65 and continue funding your HSA beyond that, when you go to finally sign up for Medicare, you have to be cognizant and know to turn off those HSA contributions about 6 months in advance of your transition date. Okay. Any questions about that?
I'll just add a comment that on the year you're covered by different healthcare, like let's say you're going to join Medicare in July, because that's when you turn 65. Then you would only be eligible to make a half a year's contribution
Correct.
to your HSA. So it could be a prorated amount. So just work
Correct.
with your HSA provider or your financial advisor just to, make sure that you get that coordinated correctly.
And we'll always give guidance on that as far as a person transitioning to Medicare coming from an HSA. We'll do our best to kind of handhold you through that process and kind of give you pointers as far as timing and how much, what the maximums are that you can put into that HSA. Okay, so now we're going to go through when to sign up. I know that many of you on today's webinar here may already be on Medicare. This is really for people who are approaching age 65 or need to do something as it relates to applying for Medicare, maybe because they're retiring. Okay. Sometimes, believe it or not, people are automatically enrolled in Medicare, and these people are usually the ones who have started collecting their Social Security benefits. I mean, you can start collecting your Social Security benefits as early as age 62. And if that's you, you're already in the system. And sometimes Social Security makes an assumption that is correct, and in other cases it's not incorrect, but they assume that if you're collecting your Social Security benefits, when you turn 65, you're probably not working. And if you're not working, you most likely do not have health benefits offered to you by an employer. And so what they do is they automatically sign you up for both Medicare Part A and B, and they send you a card in the mail about 3 months before your 65th birthday. Again, this is for people who already are actively collecting Social Security benefits and have been prior to age 65. They send you a card in the mail. Sometimes that assumption that you need Medicare is incorrect. Maybe you are a spouse of a worker who is covering you under their employer plan. Many people at times will continue to be covered under their employer, worker's employer plan, and don't need specifically Medicare Part B because that is the part that costs a monthly premium. So there's a way for you to say, I don't want this right now. I'm still covered under my spouse who works for a large employer. Okay, there's a little spot on the back of the card that you can check to say, I do not want medical insurance. You send it back and they will remove or disenroll you from Medicare Part B and not charge you for it. And you may pick it back up later on. Okay. Again, most of us are familiar with this window around a person's 65th birthday. 3 months before you turn 65, the month you do turn 65, and then 3 months after. If you happen to apply for Medicare in the 3 months prior to your birthday, your Medicare benefits will begin on the first day of the month in which your birthday falls. So even if your birthday is April 17th, your Medicare will begin April 1. If you enroll in the month of April, your Medicare will start May 1. And it kind of follows that same transition. As far as if you apply May, June, or July, it's always the first of the following month. Okay. And many different ways to apply. Our favorite is online, very easy to do. You may call the office, the Social Security office in your county, and apply with them over the phone, or you may schedule an in-person appointment where you actually go into the office and sit down with a specialist and apply for your Medicare benefits. In all honesty, though, the Medicare application literally takes about 10 minutes. It's very simple. And again, if you want somebody to kind of go through that process with you, we are more than happy to do that with you. Okay. This next enrollment period, which is called a special enrollment period, is one that is used typically for people that may not have enrolled in Medicare to the fullest extent. Maybe you applied for Medicare Part A only when you turned 65, but you waited on the Part B because your employer insurance was doing the same thing and you didn't want to have to pay for your employer insurance and Medicare Part B, so you held off. But now you're approaching retirement and you know your employer coverage is going to terminate. And so we typically like to see people about 3 to 4 months in advance of when your targeted transition date or retirement date is going to happen. Okay, so that we can kind of get familiar with each other, lay out a timeline of events, go through what exactly we need to get done prior to your last day at work. Okay, so that we know when your last day happens and your employer-sponsored coverage terminates, we've already got everything ready to go for the following day. Okay, so again, this is called a special enrollment period, and we like to be proactive and see people ahead of time prior to that event happening. But you do technically have about 8 months to go and sign up for Medicare once you leave employer coverage. Okay, so that's plenty of time for you to go and get signed up for Medicare. And this enrollment period, I'll just interject here, can occur whenever you want it to. It doesn't have to happen during this annual enrollment period here that we're going through at the end of the year. People set their retirement dates at all different times of the year. Okay, really what's triggering this open window for you to get signed up for Medicare is what we call a qualifying life event. That means you're losing coverage. Okay, and that can happen at any time. When we utilize this enrollment period, though, we go to sign up for Medicare. Medicare is going to say, where you been? Why didn't you sign up for Medicare back when you turned 65? And your response, of course, would be because I was working and I was covered under my employer plan. Well, when we go to apply, they're going to say, prove it, because they don't know where you've been. So there are 2 forms specifically that we're going to have to submit. One of them being what's called the CMS 40B. It's just basically the application for Medicare Part B. And you may or may not have a Medicare number at that point. If you don't have a Medicare number, typically we use your Social Security number here. And then we enter your contact information, and down in the remarks section is usually where I'll put a little paragraph that says, I will be losing employer coverage on June 30. Therefore, I would like to sign up for Medicare Part B effective July 1st, because nowhere on this form does it indicate when you want it to start and when they're going to start charging you for it. In conjunction with this form, we need to show them where you've been and why you didn't sign up for Medicare at 65. So there's a second form here indicating that you have been employed. They'll list your employment date and how long you've been covered under that employer plan, and then somebody in human resources will sign off on it. And this kind of serves as your exemption or your ticket to avoid any kind of problems, any penalties. Okay. This is the form that they will accept. They will not accept a written letter. They will not accept a notice of credible coverage. This is the form that they want to see. Okay. The last enrollment period that we don't like, we use this as a last resort. That is called the general enrollment period. And this is for people who maybe failed to apply for Medicare and enroll at age 65. For people who have failed to enroll in Medicare within 8 months of losing their employer coverage. Okay, there's a specific set period of time, January 1 through March 31st, that people can go and enroll in Medicare, but unfortunately, we're not going to be able to show where you've been. And so therefore, penalties may apply. Okay, again, we don't like to use this. We like to be proactive and kind of give you guidance as far as the timing is concerned, so that we can avoid this. Okay. We're going to talk now a little bit about Medicare Part D, which is prescription drug coverage. Sometimes people can feel like they are riding a roller coaster with regards to what they are paying for certain prescriptions. Okay, Medicare has different phases of how these plans that you have to actually go out and shop for, how they are going to cover your medications. Okay, so today in 2023, there are 4 different phases that people can flow throughout the course of the year. Next year, there will only be 3 phases. So I'm going to go through these very quickly here. The first phase is when you go out and shop for a Medicare plan, which again, we provide that assistance. If you feel comfortable sharing a list of the medications that you take and what pharmacy you like to fill them at, we will kind of narrow down the playing field and make a recommendation for an appropriate Part D or drug plan. And when you start using it to begin with, there is sometimes a deductible that these insurance plans will implement. It's a $545 deductible that you have to pay for your prescriptions before you get any coverage. Now, many times, a lot of these prescription drug plans may waive that deductible for generic. But if you're taking a pretty costly brand name drug, you can be assured that first time you fill that, it might be something like Eliquis or Xarelto or Trulicity, you're going to end up paying the first $545 of it. Now, I will say it's just a one-time thing. So if you're taking a variety of these expensive medications, you don't have to meet that $545 per prescription. It's a one-time thing. And once you meet it, then you kind of move into this next phase that is very recognizable. It's one where you may go to the pharmacy and only have a $5 copay or a $40 copay, like you did under your employer coverage. But this only goes on for so long. In the background, what is happening is Medicare is actually tracking not necessarily what you pay at the pharmacy counter, but what is the retail cost of that drug? So in those examples that I gave, Eliquis, Xarelto, Trulicity, those are medications that retail value are about $600 a month. So when a person gets to a point where the combination of all of these different medications that you've been filling, when the retail value gets to about $5,000, a little over $5,000, the next time you go to the pharmacy, you're not going to pay that $42 copay that you've been used to having the last few months. Now you're going into what we call the coverage gap, or sometimes people refer to it as the donut hole. And things change. Now you are responsible for paying 25% of the real cost. So it may then be $150. And many times we get phone calls midsummer, late summer. People call us and say, oh my gosh, my insurance isn't working. Something's wrong. I've been paying $40 at the pharmacy for my med, and now they want to charge me $150. Well, your insurance is working fine. It's just that you've got to the point where they're changing a little bit now. And that may go on until the retail value of your prescriptions gets to the next level, which is about $8,000. And for 2024, this catastrophic phase, you won't have to pay anything. That is the part that's kind of being removed for next year, where today, even when you get to that next threshold, you still then have to pay a little copay, maybe $4, or it comes kind of back to the rescue. Next year, it's going to come back to the rescue in full. So, it is sometimes a ride. And we do our best to kind of provide a snapshot or a report to kind of show you what to expect. We can break it down month by month by month, and what you are going to pay in the deductible phase, in the initial phase, in the donut hole or the gap.
Kelly, one question we had come in says, is this deductible in addition to the 240 in your example?
Yes, it is. The $240 deductible is for medical services, completely on their own. This little bubble that we're talking about is only for prescriptions. So yes, it's another deductible that people have to be aware of. Okay. Now there's some progress being made with regards to prescription drugs, specifically for diabetics. As part of this senior savings model, certain forms of insulin are now capped at $35 per month. Not every single form that have, people have been prescribed that are very popular. It's the good old standbys, the Novolog, the Humalog, the Lantus. Okay. Now, every once in a while, we do get clients that say, well, I don't take any medications. Why would I want to go out and buy a Part D plan? I don't need it. Or I can use GoodRx or some of these coupon programs. Well, one rule that is implemented is that Medicare doesn't want people to go longer than 60 days without having what we call creditable drug coverage. Okay, so they want you to have it just in case. They don't want it to be a reactive thing where now you get prescribed something and you don't have any prescription coverage. So they do have a requirement that if you want to go out and purchase a Part D plan, that fulfills that requirement of having it. And there are plans out there next year that are actually zero premium. So if you're a person that doesn't take any medications, we will at least enroll you in a zero premium Part D plan or a $3 plan, just to kind of say that you fulfilled the requirement of having creditable coverage. Okay. If you don't do it, what happens is in the future, if you do need it or sign up for it, again, they're going to ask the question, where you been? Why didn't you sign up for it back when you were supposed to? Now we're going to implement a penalty. Okay. And there's a formula that they use. We can get into that if that applies, but okay. So now we're going to move into these other forms of coverage that people may want to investigate. And if you're 65 or older, you see this mailbox just stuffed to the brim with mailers, and you know what I'm talking about. So we're going to kind of dig into what these different plans are, how they operate, what some of the pros and cons are to them, what some of the costs may look like under them. And I want to preface it by just saying that what we're about to go through are just simply examples. These are not real plans out there. If you would like to talk about real plans out there through different insurance companies, feel free to reach out to our office and we can sit down with you and go through different plans. But in a nutshell, there are two different ways that people can go out and get this extra coverage. So you'll see two different boxes here on my screen, and I'm going to kind of quickly talk through one way. I know we're kind of at our hour mark. I've got about five or 10 more minutes if you want to stick with me. I'll talk about one way and then we'll talk about the other way. So one way, and I'm going to kind of reference the one here on the right-hand side first. This way is for people who want to rely on their good old-fashioned red, white, and blue Medicare card for their benefits. Okay. The nice thing about using your Medicare card is that it is pretty universally accepted all over the United States. Okay. It's not being dictated by a private insurance company. It really doesn't have any networks. Your network per se is whether or not the doctor, whether you're in Michigan or in Florida or out west, is whether or not they take good old fashioned red, white, and blue. Okay. If they do, then you may go there. And when you present that Medicare card, you've got that deductible that applies. I'm just going to kind of highlight this example that I'm going through here. You show that Medicare card, and remember that $240 deductible, that's going to apply. And in the meantime, you're paying about $174 a month to have this card, specifically for Part B. So you've paid your deductible, and now Medicare is going to start to cover your expenses, medical expenses, at about an 80% share. If you would like something to kind of pick up the leftovers, there are different plans out there called Medigap or supplement plans. I'm showing an example of one called Plan G. It's kind of the Cadillac these days. And you go out and purchase this extra insurance from an insurance company, and you'll get an ID card from that insurance company, and they will charge you a monthly premium. I have an example in here of about $130 a month. So when you go in for your appointment or your test or your surgery, you're actually showing two different cards, your Medicare card and this supplement card. And you're paying a monthly premium for both. But when you use them together, the intent of that supplement plan is to cover the leftovers. So when you use them together, it kind of looks like this, where Medicare's covering the 80% and this extra insurance covers the rest. So there's very little left for you, if anything. You've paid your deductible, and typically that's all you'll pay for the year for any Medicare approved type of services. Now, the downside to this particular choice that people have is that when we look at things like dental coverage and vision coverage and the gym membership and these other things that are being very heavily advertised, these types of plans do not include those. Most of them do not. And the other thing that this scenario does not include is nothing for prescription. So what people have to do is they actually have to go out and purchase a separate insurance policy called a Part D plan for prescription coverage. And that may cost a monthly premium as well. So it's kind of a learning curve for people. You're going from having one ID card to when you were working and you show that everywhere at the pharmacy, at the hospital, at the doctor, to now you've got 3 different ID cards. Okay, the Medicare card and the supplement card always go together when you're going in for any kind of medical service. And the third card you would get and only show at the pharmacy because that's all it's good for. And if you wanted dental coverage, there may be another ID card and another little price tag up top here. And vision insurance, everything is kind of pieced out separately. And it can sometimes get kind of costly every single month. But the trade-off is that you've got that peace of mind knowing, number one, you can go to any provider in the country that takes Medicare. You don't need a referral. and you've got that full coverage. So this is the way that my mom went. My mom and dad actually went different when they went on Medicare. My mom chose this way because she had some things that she wanted to have done or that she was concerned about, and she would rather pay a monthly cost to have this type of insurance so that when she went in for her care, she had a choice of where she went and knowing that it was covered in full after her deductible. Okay, she does not have any dental coverage. She does have a separate Part D plan. Okay, so this is one choice. My dad, on the other hand, has something different. This is called Medicare Advantage. Okay, so these plans work a little opposite from what we just got done talking about. These plans are actually administered through private insurance companies. Okay, these private insurance companies partner with Medicare, or actually, I should say, they replace your relationship with Medicare. When you sign up for a Medicare Advantage plan, which another term or how they refer to these is Part C, and they usually include Part D. Okay. But these insurance companies that offer these plans have a contract with Medicare. And basically, in that contract, it says that the insurance company that you sign up with is going to assume all of the administration of your benefits. And what happens then is because Medicare, this red, white, and blue, they don't have to do it anymore. They're not involved. But they do pay these insurance companies kind of like a fee every month or a compensation every month to do all of your stuff. So this red, white, and blue Medicare card for people who are on Medicare Advantage, you're going to stick that away in the safe. You're not even going to show it. Okay? You're going to actually use the insurance ID card that is through the insurance company that you signed up with. And they are the ones that set up the schedule of what you're going to pay for certain things. They are the ones who may require you to use their network. Okay, so there are some trade-offs. Many of these plans are offered at no premium, zero. The trade-off is that when you go in for certain things, certain services, there may be some out-of-pocket costs. So this is the way that my dad chose to go, and it was simply because he did not feel that it was necessary for him to purchase an expensive Medigap policy like my mom did, because he didn't hardly ever go into the doctor. He didn't have a lot of things going on in his world. These plans sometimes will also include dental and vision and hearing and prescription and a gym membership and a little over-the-counter benefit card for you to go and spend money at the pharmacy on things like Band-Aids and Tums and aspirin and things like that. Okay. The trade-off, though, is that you can accumulate a lot of these different co-pays. You might have a good year, you might have a bad year. The co-pays are usually capped at on average about $5,000 a year. So it's a little more of a gamble. Now, when we look at these two different choices that people have side by side, we can kind of see that, the Medicare Advantage plans, most of them are no cost. They may utilize a network. They may require you to see certain doctors. They may require you to get referrals. They may require prior authorization before you have any kind of surgery done. And they will require some kind of copay for that service. And if you have a good year, you will very much enjoy these Medicare Advantage plans. If you have not so good of a year, you might not like it so much. Okay, that's just the gamble. On the other side of the coin, you may choose to pay a little bit more every single month for the flexibility to use providers nationwide and to have that peace of mind knowing that you've got two different forms of insurance coverage working together to cover you as a whole. But knowing also that you have to buy separate prescription coverage. You may have to buy separate dental coverage, separate vision coverage. Okay, so one thing that I kind of like to explain when people are brand new and choosing between one or the other is when you're brand new, you are given what I call a golden ticket. The golden ticket just means that you can sign up for either one of these without having any kind of questions being asked about your health. So many times when people are brand new and receive this golden ticket, which is good to use within the first 6 months of you getting on Medicare Part B. That's the trigger. When people are trying to decide if you are a person that may have some significant health issues going on, you may be more inclined to going with this Medigap, because knowing that you're going to be utilizing your benefits throughout the year, you may want that peace of mind. For other people who receive their golden ticket that don't have a lot going on, they may spend it on a Medicare Advantage plan. The important thing to know is that year after year, we get together with our clients and do a review and just kind of say, this is the plan that you picked. This is how the insurance company is going to tweak it a little next year. What's going on with you? We're at a point right now where we can make some changes if necessary. And let's say that you have chosen to go with a Medicare Advantage plan and now have been diagnosed with some kind of chronic condition that has led you to pay, $5,000 for the year out of pocket. And that condition is going to be going into the next year and the next year. It's never ending. And you come to me and you say, I don't really want Medicare Advantage anymore. I think I would like to apply for a Medigap plan. At that point, when we go to make that switch, the first thing that the insurance company is going to say is, where's your golden ticket? And you're going to have to say, I don't have it anymore. I spent it, 5 years ago over on a Medicare Advantage plan. And I liked it a lot while I was healthy, but now I'm not so healthy. And I want to come over to your plan now so that you cover all of my bills in full. Well, they're going to say, so you didn't pick us day one when you first had the opportunity. And in the meanwhile, you haven't paid us a dime of premium. And furthermore, you're coming over to us with some significant medical bills that we would have to cover. They have the opportunity to say, no, declined. Okay. You have to qualify for this, either elect it up front when you're brand new. Then you can get in with your golden ticket. But if you happen to spend your golden ticket on a Medicare Advantage plan, you may have a few really good years where you are saving a lot of money and you're enjoying some of the extra benefits that come with Medicare Advantage. But if things happen, you may have some issues being able to switch to a Medigap plan because they are going to ask questions about your health. And if you have a significant diagnosis, you may not be approved for it. Okay. So lots of pros and cons to both. Again, we really want to take kind of a personalized approach with folks one-on-one to look at the whole picture and to maybe make some recommendations. Not necessarily just a recommendation for today, but in the future. We're all getting older. The probability of things going on in our world relative to our health becomes greater and greater. So we just want you to kind of be aware of what some of the financial risks involved are, and the ease of being able to switch, accessibly between these two different types of products. So again, here's kind of the overview as far as Advantage plans or Medigap plans, who you may have access to for providers. They may have a PPO or HMO. With Medigap, you may use any provider nationwide that accepts Medicare. Medical conditions and being able to, again, freely move between one product and the other. You can always go from a Medigap plan where someone else is taking on the risk. You can always go to a Medicare Advantage plan because you're going to be the one assuming the risk, but it's a little more difficult to start with Medicare Advantage and want to, upgrade to or change to a Medigap plan. Prescription drug coverage, it's usually included in Medicare Advantage where it is not under Medigap. You have to actually purchase that or enroll in it separately. Cost for insurance, Medicare Advantage, very low cost, if any. Medigap is a little bit higher, but the trade-off is that the coverage under Medicare Advantage, you may be responsible for copays. Where on a Medigap plan, depending on which one you choose, you may be covered in full. Okay, who's actually administering your benefits? With a Medicare Advantage plan, again, you are kind of replacing your Medicare benefits with private insurance. And so therefore, that private insurance is going to be the one who is serving as your primary payer of your claims. Where with Medigap, you are still using Medicare as your primary, and you have just purchased supplemental coverage that is serving as your secondary. Okay. We're going to talk a little bit about spouses or dependents, and then we'll wrap it up here. Typically, if you are an employee that is going to be transitioning to Medicare and you have a younger spouse or children or anybody else that you may carry under your benefits, when you go on Medicare and they're not eligible for Medicare, typically we'll look at two different scenarios, that one being COBRA if it is available, and the other is going off and looking for an individual plan that you may purchase through the health insurance marketplace. So again, I will list here our contact information. You are more than welcome to call our office, email me. Let us know how we can help. We're more than happy to field questions. We really want to damper the anxiety that comes not only with enrolling in Medicare for the first time, but reviewing your plan year after year and making sure that you don't just go, for a couple years without looking at it, because there may be some changes that occur within your plan. There may be some changes in your world. And really, when you renew for another year, you're kind of locked in. So it doesn't hurt to talk to a licensed broker, if not us, at least somebody that you may trust here to review your benefits with you. So thank you again for inviting me to present today. I'll go ahead and stop sharing and let you take over.
Thank you so much.
Silent round of applause for you, Kelly, because that was great information. So thank you so much.
Please, everyone, join me in thanking both Melissa and Kelly for joining us and presenting this afternoon. Thank you both so much for your time and your effort in bringing such an informational webinar to our Bedrock alums. Additionally, I'd really like to express my gratitude to everyone who joined us this afternoon. I know we went a little bit over, but hopefully you found this information to be incredibly valuable. Please keep your eyes on your emails, as we will be sending a follow-up email later on this week. You can expect that to include a video of today's presentation, links to other Retire Well programming, contact information for both Kelly as well as Melissa, and then any follow-up resources that they have for me. We'll make sure we get those your way. Additionally, I encourage you to visit the Retire Well website and check out the programming there if you haven't already. Lots and lots of valuable information to be shared there. Lastly, as always, you can find additional resources and information on future events from the Alumni Relations Office by checking out our website at gvsu.edu/alumni. Thank you again, and enjoy the rest of your afternoon, everyone.